Welcome back. Thanks so much for joining us. We're joined now with Sharon Miller and Makayla Rangel. And you're with the Schliemann Center for Women's Health Education at the Baxter Regional Medical Center. Well, that's a long
right.
title.
Yeah. Yeah, she's like, okay, spit that out.
And you brought Makayla with you today. And
Yes.
and we were talking earlier about the reason you were going to be here on the show today. And you have, is it 2 sons? Is that right?
2 boys.
2 boys. And they have a genetic, would we call it a disease?
Condition.
Condition,
Yeah.
okay. And what is it called?
Fragile X syndrome, and the textbook definition. I brought this piece of paper.
Okay.
I could describe you in many words, but it's a genetic condition that changes the X chromosome whenever they're in utero, whenever the mom's pregnant with them. It's a very common inherited intellectual disability, and it will affect them for the rest of their lives. There's many, many, many people out there that have it that probably don't even realize they have it. Children that have problems in school that just go misunderstood.
Okay.
Things of
So
that
there
nature.
are people that have it and don't know it, and it's an intellectual condition.
Yes.
And how is that manifested? I mean, what's some of the
outward signs.
Yeah, the outward signs.
There is a lot of, so far as behavioral problems. I mean, like in the beginning, it's a global delay. Like they don't sit up on their own at an appropriate age. They don't crawl. They don't walk. I mean, they do eventually, but it may take therapy. They may be 1 or 2 years old before they achieve those developmental milestones, but they're just delayed because of many different reasons. I mean, they have loose connective tissue problems to where their joints and their muscles don't develop at a normal rate that children do.
So there's some physical things going on too.
Yeah.
Yes.
Okay.
They do have a list of physical features that I wouldn't say most Fragile X children do have them. They just may not have all of them. For example, flat feet, low muscle tone. They have a larger body, like they're very tall usually. They have an oval, long face, usually big floppy ears, like where their top of their ears, are really long. Very soft skin. I mean, soft skin that us women would dream of, and they're just born with that, and it naturally stays with them.
Are there more males than females, or does that play into it?
Females can carry it, but it's usually more apparent in males because of the X chromosome, which let me get this right. The females have the 2 X chromosomes, and so if one of them is a Fragile X, then it
can compensate.
It can compensate, right? But since the boys only have 1 X, then it can affect them more drastically. Is that right, Makayla?
Yeah.
How is this tested? Like if someone suspects, is it a simple blood test?
Correct.
Okay.
However, in my specific situation, we had to go to Children's in Little Rock and see a genetic specialist. But I do know that once my second son came along, because we got pregnant with him on an accident, and he came along a lot sooner than we had planned, and so we had not had a diagnosis for my first son, and then my second son came along. And so all we did is we had our PCP, our primary care physician here locally, just ran a blood test through our local hospital just for that gene specifically. But my first son, Jacob, he had a full spectrum of genetic testing ran in Children's in Little Rock.
Do you know the percentage of people that acquire this, or?
In one thing I read that said that in males that it's about 1 in I believe it's 1,500 that. But
you said both of your boys are have this gene.
Yeah.
And how rare is that? Is that rare or not rare?
To me, it was very shocking because I thought that it was rare from the statistics I had read as far as the percentage on who would and would not have it. However, I've never been tested. We assume that I'm a carrier due to the fact that I had minor problems growing up, as far as like we thought I was dyslexic and things like that. But overcoming that was just a determination of continuing to read and conquer that myself.
Yeah.
But I've never been tested, so we're assuming for me the specific numbers that go along that correlate with diagnosing Fragile X. We're assuming that my numbers are higher due to the fact that both of my boys have that. But it is rare. I mean, a lot of the families that you'll see one child in the family that has it and the other children are not affected.
But is there any way to test before you bear children to
yes, I mean,
X that out? Yeah.
like if I would have had the appropriate education prior to getting pregnant with my first child, because we had difficulties conceiving him, and that's one of the problems with Fragile X.
Okay.
The history of it, so to speak, in women. I'm a carrier, that's what we're assuming, so that's how my children got it, that's how my boys have it. But if I would have been tested prior to conceiving children, then there possibly would have been some precautions that we could have taken, but they're not as widely known about, because it's not just fertility testing, it's a more in-depth fertility testing on the woman's egg prior to conception.
Yeah.
Is there a treatment for this other than, therapy? There are no drug treatments or anything?
There are the FRAXA, F-R-A-X-A organization. It's a nationwide organization, have a group of scientists that are studying drugs that are possible treatments. There are 3 in the final stages, and they don't have exact or specific names, but 2 of them are called mGlu-R5 agonist. And the mGlu-R5 is something that everybody produces, but a woman produces too much of, and that's part of what causes the syndrome itself. And so the drugs that they are testing, and then the other drug outside of those 2 is called R-baclofen. Now those are the names they are putting to them right now. I don't know once they pass pharmaceutically if that will be their names after this point.
So they're not out there yet?
They're not yet, but the last updated information that I got from FRAXA, they were expecting it hopefully within another 2 years to be on the shelf. And there are other testing going on that are in the beginning stages that are going to take longer.
Now, did you mention you want to start a support group? Is that what you said?
We had talked about this. I became aware of this from a Lunch and Learn program that we had at the Schliemann Center, that Dr. McQuinja was talking about milestones in children. And Makayla was there, and she was asking questions about this, and Dr. McQuinja was very knowledgeable about it. And the more they talked about it, that it became apparent that that the earlier you can intervene, the better off it is for the child. And that way that they can, if it's extra tutoring or whatever extra help they need, they can get that. So from there we started talking about there may be other parents who would like to find out more about it, or would like to talk to other parents of children who have the same condition. And so I told them I'd be glad for the Schliemann Center to be the go-to point for that, and that's what we wanted to just get information out there. If parents have questions about it, if they would be interested in starting a support group, or if they would just like to be in contact with Makayla or with other parents, they could contact me. And that number is 508-2345. And that's the Schliemann Center.
Okay.
Now, you were talking about like some cognition difficulties and stuff, but those can be compensated for, correct? With extra effort, possibly.
That is correct. The severity of it, Fragile X, in comparison, is like a sister to autism. They're not the exact same thing. Autism is diagnosed clinically. Fragile X is a genetic condition. However, they have a lot of the same features. I mean, the things that they do. But at the same time, I lost my train of thought. Where was I going with that? What was your question again?
Oh,
I brought autism into it.
These can be compensated for, so difficulties are not necessarily lifelong.
No.
Okay.
Therapies, she was talking about with early intervention, and that's what I've seen the most help with. Like my children have a delay in their speech. It's not that they can't talk. They make sounds, they try. They just can't pronounce their words. And what I've seen is that they generally have this problem. It can range all the way up to 4 to 7 years old. It can even range older than that, but they will talk. It's just a delay, and so it's that way in education too.
Yeah.
It's a matter of finding abstract ways to teach them things that maybe a traditional child would get, you know, just from regular teaching. But they do have focal points that are harder. Like I've heard mathematics is a harder subject for them to comprehend due to the different equations and things of that nature.
Yeah.
They're very fact-driven as far as their education, but I'm yet to still experience a lot of that because I'm still learning. You know, we're just 3 and 1 right now, so I'm eager to talk to other parents that have children that are older and know what's going on with them.
How old are your boys?
Joseph, my baby, is 18 months old, and my Jacob is my 3-year-old.
Okay.
My 2 boys, 1 and 3.
Well, we're trying to get interest in the condition called Fragile X for people that are in this area. Is there if there is a question of if they recognize the symptoms, how can they confirm that they do have Fragile X? Is there a way to do that?
My first step would be to discuss it with your primary care physician.
Okay.
Let them know that you're concerned. That that was probably the first thing. Is Jacob was our first child and we were in denial about it. However, my mother kept saying he should be doing things. It was my mother that was our standout that said he's not developing the way he should be. And to a certain point we ignored her and got mad about it, and then we finally started waking up and realizing she's right. You know, we need to talk to our doctor about it. And so what he did is he referred us to a specialist out of Little Rock. The specialist saw us, and he was the one who referred us to get genetic testing done. And I recommend that. And I know finances are a concern, but I do want people to know that there is financial help out there for them.
And you have information on how they can get that help?
I do, and if their local DHS service doesn't, you know, one thing that we didn't qualify for was any of the Medicaids. Financially, you know, we were above those limits, and so Tefra is a type of Medicaid, and it's something that they base out of your yearly income, but it is an extra insurance, so to speak.
Well, you've done the research, and you're a wealth of knowledge, and I encourage people to call, and they can call you, is that correct?
The Schliemann Center, yes.
Okay, they can call the Schliemann Center, and the phone number, once again, I don't think it popped up on the screen earlier, but let's do it now.
508-2345.
It's not coming up, so I'm not sure why. There it is.
Oh, good.
And thank you so much. This is a very interesting topic, and it's I've never heard of it. I'm not sure if you.
No, I haven't.
Before,
and in the last few years, there's supposedly been a huge increase in the number of children diagnosed with autism. Well, quite possibly they're not autistic. It's this instead, because it does have to do with levels of
And they both have a lot of similarities to them as well. I mean, so it's something that can be. I mean, Jacob may be diagnosed with autism as he gets older, you know, because he has features of it, but it's not a 100% guarantee that he's got autism. So every child varies, and the severity of it varies. Not all children have the same symptoms. You know, he may struggle in one area while another child with Fragile X prospers in it. So it's not all the same. And these children look like normal children. They don't, even though they have features that can make them stand out and look different. Not necessarily, you know what I mean?
Or it's not, you know, it's always tall for his age. You know, that sort of thing. It's not, there are no physical features that would stand out at all.
Well, the best thing to do is get as much information as possible, and here's the source to get it from. And if you have a question about one of your loved ones, then the Schliemann Center is probably the first place to get that information from. And talk to your doctor. I think that was what you recommended too. Thank y'all so much for being here. It's a great topic, and I hope that we may have helped in some way. Thank you.
Thank you.
All right. Up next, to go to number 2, we're going to talk with Eric Toddy about the Baxter County Time Mentoring Program and his volunteer appreciation banquet. Stick around. You're watching 726.